Hello, warriors. Hello, healers. Oh my God, it has been quite a while since I did an update video. Ugh, you guys, I always have to give you an update, right? Like Ty and I've been traveling a lot, studying, improving our skills, seminars, conferences. We just came back from one, and it has been a lot on my body. And I have to tell you, I am so, so grateful for IV vitamin therapy. I am super grateful. It's summer. Well, it's about to be summer, and all of us gonna be out there, and many of us do not have the protection that we need to keep us healthy. As you guys know, I have sickle cell anemia, right? And sometimes when I don't rest properly, like I've been on the road and I am about to go to another seminar. I was invited to another seminar by Quicksilver this Saturday. The time I'm recording this is June already. So Saturday, June 7th, I'm gonna be at the in Hoboken because Dr. Shade is coming. And he was like, nope, I gotta meet you. We gotta spend some time together. I'm like, okay, all right, I'm coming. So it has been a lot. But I do these things because I want to make sure that I am keeping up with my skills. I am training my staff. And there are so many options and resources out there for you guys, like so many. And that is why it is my duty, my job, what I love to do to keep up with the changes that are happening in medicine so that you and I, right, when you invest in yourself through us here at the Wellness Corner NJ, we are giving you the best recommended, protocols or treatments or services, right? Because the things that used to work years ago are not working now. And that is why I'm literally screaming and yelling and like verbalizing and vocalizing how IV vitamin therapy is a must. Before, I wasn't really promoting IV vitamin therapy. I was looking more at detox, which we still need to do 4 times a year, and then just the other herbs but now I'm literally going to tell people if you have an option, I mean, if you have a choice or if you have to make a decision, and you have a choice between IV vitamin therapy, my $15,000 gut decluttering program, yes, functional medicine, that is, for results, go with IV vitamin therapy. Why? Because our cells, our body, the body, this vessel that we use every day to live this life that we have now, it's been attacked. I know it sounds really weird. Doesn't really have all the things that it needs to function properly. Our cells are depleted. I was watching a report from the environmental working group, and they mentioned how our toxicity level, that the toxins that are being injected into our environment has increased. The toxins have increased. So that is why the toxicity bundle that I recommend here from Vibrant, the UN test, is a must because there are like 85 millions of toxins being produced and injected into our environment, and we are not even aware of that. And guess what's happening to our cells, right? When we come in contact with these toxins. Well, yeah, we're inhaling them, we are eating them, we are drinking them, we are putting out in our face, in our skin, in our hair, like it's everywhere. So today I'm doing a Facebook Live about the 3 things that I do consistently that I recommend for my patients. And if you are one of my patients, you know what I'm saying is true. First is identify the root causes, right? That's why people come to us because, you know, they are clueless of what's going on. Second is detoxification, at least 4 times a year. And the third, which is most people are not doing because it's not covered by insurance, because we think we can just go and pop a vitamins, right? Not the same. Absorption rate is IV vitamin therapy. Okay, so I'm doing a whole Facebook Live about it. You can, follow me on the Wellness channel or the Dr. Jennifer Genty or the Jennifer Genty Facebook page and Instagram page to learn more. I'm also gonna have Marilyn download this Facebook Live and put it on the podcast. Maybe I'll put it on the YouTube, but healing doesn't have to be complicated. And yes, you will have to invest in yourself every single step of the way. Okay, it's not like I do 3 IVs, 5 IVs, 10 IVs, I'm done. It's like, okay, I've done so many IVs. I still don't feel like I am like myself. I have not reached my goals yet. Because the thing you have to understand when we do IV vitamin therapy, you come here, I'm in control of your body. We're injecting this powerful solution to your body, and then you go out in the world. You go meet, friends and family. You go to work. You are literally like expose yourself to toxins at a rapid rate. So that's why IV vitamin therapy is important. So let me talk to you guys about what's coming to our clinic in June. So happy June. We only have 6 months left of the year 2025. It's almost gone. And I had to really sit with myself and ask myself, like, did I reach my goals? I'm halfway. Like, what's going on? And the number one focus for us here at Wellness is to really bring in services that are going to not only impact your life, that's where you're going to see improvement in a short period of time. And we have done that. And one of the services that we, introduced a while back is the MIC B12 injections. Oh my God. That injection is gold. And you watching this video, you have taken that injection, you know exactly what I'm talking about. Just this morning, we had a nurse that came to us, and she was telling Ty, and I also, eavesdropping because I want to know what's happening. She was telling Ty how this is her third injection, and she started feeling it after her second injection where she wanted to go to the gym. She was telling her fiance or her boyfriend, like, honey, let's go to the gym. And her boyfriend was looking at her like, who are you? She went from being tired, exhausted, to having the energy, the stamina to get up and move her body and go to the gym. So MIC B12 was one of my, my God, it happens to be the most amazing product that everybody sees a result with in a short period of time. Okay. So, and as you guys know, and I've mentioned this a zillion time, we've worked on this product. I've tested, studied, examined Make B12 before I will list it to you guys. And that's what we do with every single product we have here. Now, the next one we're introducing this month that everybody can benefit from, that I've been testing on myself, on the team, and we had 5 patients received it and they gave us great feedback. So thank you, Cassidy. Thank you, the Gonzalez family. Thank you, Dorothy. Like, thank you all. Though you know who you are. Thank you, Carlos. Because again, my goal is to never put the product out there just to put a product out there. That's never me. I have a consciousness and I practice with integrity and transparency, and I want everybody to be healthy. I'm serious when I say I want you to feel a difference after you leave my environment, after like interaction with me or with my staff or with any of the services. I want to leave you with an increase in energy, increase in cognitive function, increase in immunity, increase in, I don't know, mood, like decrease in inflammation. I want to leave you with an increase with everything that I recommend. So the next product that we are so, so, so excited about, we're bringing into the clinic is CBD IV. Now, again, the time I'm recording this is the first day of June. We're gonna be shouting about CBD IV. And if you see all the emails going out, all the videos going out, like if you felt triggered, I want you to ask yourself why. Why? Because at the end of the day, our job is to give you all your options, all the resources, all the tools that you need to make the best educated decision for your body. My friend, conventional medicine is not going to work for you. Yes, it's covered by insurance, and that's why it's not working. Because you have a third party, you have another company telling your doctor what to do with you and what you're entitled to, how you should be treating your body. Functional medicine is what you're looking for. And yes, functional medicine is an investment. And whenever you invest with yourself, whenever you invest in yourself through someone else, or whether it's me or another doctor or coach or whatever, right? You pay attention and you value that investment because it's like, okay, I work really hard for the money and I'm going to do whatever I need to do. Okay? So just like we introduced the MIG B12 and people started seeing an improvement after two, three, fourth injection, that's the same thing with the CBD IV. Now, you all know what CBD is, right? Like we all heard the word CBD. And I have tried the CBD and recommended CBD for my patients, but I couldn't find a product to really give me a great outcome for my patients. And I was on the search. I'm like, okay, I wish there was an IV. That was like years ago. I manifested the CBD IV. I'm like, it's natural, it's a leaf, right? And the CBD IV that we are going to promote has no THC in it, so there's no opportunity for you to get high or have altered mental status and not be in control of your body, none of that stuff. I've been working with the CBD company since last year. They contacted me like 6 months ago. And I was skeptical, just like many of you guys gonna be skeptical, like, what? No, what CBD IV? Is it safe? Is it just like you? Because again, with IV vitamin therapy, safety is number one concern. Because once I put that solution into your vein, I cannot take it out. And so for my 9 years of owning this clinic, we have had no emergencies, and I would love to keep it that way. Emergency is something that we manifest, right? Like if you think you're gonna be sick, you're gonna be sick. If you think this and that's not gonna do well in your body, well, that's exactly what you manifested. That's exactly what you're gonna feel. So I have no emergency here because we always think about safety and we always test every single product, every single recommendation, every single thing that I am literally telling you to purchase, to invest in, I tested way before I put it out there. So CBD IV happens to be something that I was interested in because I get so many people anxious coming to me with anxiety. So many people have high level of cortisol that's literally creating oxidative stress, so then they feel like uneasy. CBD is good for sleep, right? It's really good for sleep. Whether you're struggling with insomnia or you desire to have a deep sleep, it's good. Now, I asked the Gonzalez family, right, to do CBD and they told us after only 1 ml, and the dosage is gonna go up. We're gonna literally go customize the dosage per whatever is going on in your body. And they told me after 1 ml, they felt little relaxed. So if you're like, okay, I suffer with chronic anxiety, CBD is for you. Even if you don't suffer with chronic anxiety, you have inflammation, CBD is for you. Autoimmune condition, you can use CBD. CBD is for every single symptom and diseases out there because the primary goal of CBD is to decrease inflammation. And we all inflame. All of us are inflamed. If you have cancer, CBD is for you. If you have any pain, any discomfort, any stiffness, CBD is for you. Just like I promote vitamin C for all the humans out there, I really don't see why anybody wouldn't do CBD. I don't. Right? Again, it's dose dependent. Because again, if you come to me with chronic back pain, that 1 ml that I just mentioned that I, infuse for the family will not be the best dosage for you because you have inflammation and it's in your back, it's on your spinal cord, you have muscle spasm, you have you have knots, like you have musculoskeletal, you have a lot of pain. So we might have to increase it. So I'm just like, we're doing an info session, a Q&A, an information session for CBD. As soon as we have the link, I would love for you to register and I would love for you to tell all the people that you know that are struggling right now for them to show up. So Ty, who happens to be a CBD expert, even before Ty is, the patient coordinator, I call it because he's amazing. He does a lot here. But he does mostly the IV. He's been specialized in IV now. He's gonna be an IV expert. But he was working in a dispensary way before I met him. So he knows a lot about CBD, a lot more than me. I had to learn. Like I had to sit through a lot of seminars and we have training coming up just to make sure we finalize everything because again, safety. And also I want people to feel a difference with the CBD. So it's coming June. We have an info session, I believe it's June 24th at 5 p.m. So if you have any reservation, you don't understand how this is gonna work, and you Google it and Dr. Google telling you it's dangerous, or the FDA is like, oh, don't do it. I need you to register for the info session so you can get the information, ask your questions, and then sign up for the promotion. Okay, so I'm super excited. And again, I brought CBD into our clinic for anxiety, insomnia, inflammation, pain, discomfort, and overall health. Okay. And over for the past few days now, for the next few days, for the past few days, for the next few days or few weeks, we're gonna be educating you to videos, to posts, with literature and studies to back it up on the evidence of CBD helping for autoimmune, multiple sclerosis. CBD is really good. Cognitive function, CBD is really good. Like if you have brain fog, CBD is really good. So that's coming. And then we are planning a party, a Niagen party. So you might be saying, what is Niagen? Niagen is the sister of NAD. What is NAD plus? NAD happens to be the most luxurious infusion that I offer, but I never really talk about it. Never really talk about it because one infusion of NAD can run anywhere from $600 and up. It is an expensive infusion, but it is one of those infusions you'll feel your brain open up right away. So I use it for CEOs. I use it for practitioners like myself. I use it for, C-suite executives that are really want to use the brains and to kind of really focus and get things done. I do NAD just like I do vitamin C once or twice a month, depending, or more when I'm traveling. I also do NAD once a month. I do. People ask me, how do you keep going? Like I literally feed my cells exactly what they need. On a regular basis, I listen to my body. The food can only go so far. I spend all my money on me. Can I be honest with you? I spend all my money on my health and also travel and donations. I have two pro bono cases right now I'm working on. Yeah, I don't talk about these things because it's like, there's no need to because I'm not trying to make me look good. But I am blessed. And my health is my number one priority. If I have $1, I will spend every single penny on me. Because when I'm good, I'm healthy, then I can literally show up and make an impact in the world for the people that need me. And I never look at my health like, okay, I did 5 IVs, I did 10 IVs. Oh my God, why am I still struggling? Never. I never look at how many. I just listen. What do I need? What does my body need right now? And I just do it. Even if I don't have the money, when I didn't have the money, right? I ask. I'm like, okay, where can I get the money? Or what can I do now to give me the energy, the stamina, the endurance, the cognitive function to think? Because many of you guys are not thinking. You don't have the brain capacity to think for your future. I have so many entrepreneurs in my clinic, like patients that are entrepreneurs that are working for people. But they have the entrepreneur spirit because they are so mentally fatigued or mentally tired, they don't see it. Because if your brain is not on, and that's why CBD is gonna help, and also Niagen is gonna help, it's for the brain. If your brain is not on and you have inflammation, and you have no inflammation, I'm going to Dr. Shade's event this Saturday. It's all about brain, no inflammation, and how toxicity leads to no inflammation. The whole day from 9 to 6, we're all gonna sit in that room in Hoboken at the W Hotel, like hand-selected practitioners that are making an impact in the world. Okay, like I need my brain. And I am not ashamed to say I spend like $10,000 on my health, $20,000 on my health, on me. I'm not ashamed because it's me. I am my best investment. So I never look to see, okay, well, how much is this IV? $10,000. Oh my God, I did $10,000 worth of IV or health things, and then I don't have any money. And then, because the thing is, when we are holding on to the money and we don't prioritize us, we don't spend on us, what good does that make? You're gonna struggle, you're gonna feel unwell, and then you're not gonna reach your goal. Many of us are so depleted that we need to do IV for a whole year or more, right? You're like, oh my God, that's a lot. I don't have the money for it. The question is, how can I make this work? And that's why we have promotions. When I have promotions like that, even if you don't feel like you need it, grab the promotion. Grab it. Payment plans, grab it. So, Niagen, we're going to have a Niagen party, which is a Saturday with catering food. And I would love to see all of you. What is Niagen? I'm going to do a whole video about it. It is the sister or the brother of CBD. I'm sorry, not CBD, NAD, sorry. NAD plus, you can Google it, NAD plus. So it is an infusion that can take place within an hour or less, depending on the dosage. With NAD, if I were to give you NAD, it's like 46 hours here. Because NAD is so powerful, but NAD has a lot of side effects attached to it. And that's why I never recommended it as a first infusion, because I know, okay, you have to be here for 46 hours. Yes, you're gonna feel the effect, you're gonna feel good, but then again, we have to monitor the side effects. And when I do it, it can be a little uncomfortable. So I don't promote it. I only give it to people that already know about it. They know about it, they've done it before, and then they're looking for a home and they come to me. And they are aware of the timing, the duration, also the possible side effects of it. I discovered Niagen, which is way lesser side effects with better outcome. And Niagen is good for brain. Literally, it's good for brain. It's good for energy. It's good for cellular repair. But again, I'll do a whole video about it when that's happening. So this is gonna happen sometimes in July. But it's just that's the date we're looking at. We'll let you know. But for now, we're focusing on CBD. CBD for pain, CBD for inflammation, CBD for nervous system regulation, CBD for cortisol. You can even use CBD for hormonal imbalance. I'm going to do a whole video about that. I was shocked. I'm like, what? Like, there's so many things you can use CBD for. It's amazing. CBD by mouth doesn't work because when you take CBD by mouth, that's why I never, again, promote, recommend it. There's a company that I used to recommend. It's called Your CBD. One little tiny bottle of that CBD was $50, 2 ounces. And I used to recommend CBN for sleep and CBG for energy, right? Like for my patients that are struggling, I have patients that will come to me on sleeping medication like Ambien, Restorel, Trazodone, and I wanted to get them off. Then I will recommend the CBD, but they will go through that battle very quickly. So now that I found CBD IV, which is better absorption rate, faster result, like outcome, you're gonna feel it, my friend, like feel it in a good way, that is. Okay, and then we can always customize it to your specific needs. And the promotion is coming. Again, we're gonna do more video about that. We're having a whole info session, a Q&A info session on July 24th. If you're curious, bring yourself. Even if you're like, okay, I'm not interested in this promotion, I just want to learn about CBD, come. Gonna answer your question. You're gonna see why we all need to do CBD. There are so many options out there. You don't know what you don't know. And it is my job, my duty to bring them to the surface for you to see, okay, what am I missing? CBD for inflammation. Right now, I have a patient. That patient had multiple back surgeries, multiple, and still in pain, right? Um, Medications, got hooked on medications, like no good. We don't want to be addictive to medications. Um, Medical marijuana is not something the patient wants because of her religion, and CBD has been working for her. It's amazing. So stay tuned. This is what's going on. We're going to be talking about CBD like nobody's business. I want you to educate yourself. Do not delete the messages. Do not delete the emails when you get them. This is an opportunity for you to learn because you never know w- when you're going to need CBD. We never know. And then if you feel called to participate in this promotion, let us know. Okay, it's gonna be an amazing price, and then you're gonna feel the difference within 24 hours or less. I have patients that literally be like, oh, I feel the difference. I'm more calmer. If you feel like you're irritable, right? Like you're always on the edge, CBD is for you. If you're screaming and yelling at your spouse, your husband, it's like, I don't understand. As you're working on balancing your hormones, explore CBD. So this is the updates that I have for you. We have been working so hard behind the scene. Not hard, but it's beautiful. It's like it's beautiful when the services we get to bring to this clinic. We're about to go to another a week-long training on IV in Orlando. So there's so many things, so many things we're doing. We're gonna be doing more events here. I'm also working with my catering. She's gonna be making some samples breakfast. I don't know, mimosa, is that what you call it? What is mimosa? Like breakfast things, food for you guys. So I'm working on a lot. And I just want you to open to receive. And then when you feel like, okay, this is too much, just meditate. Ask yourself why you feel this way. Because again, information is to give you the freedom and the power to be in control of yourself and also the decision that you're making. All right. So I hope you're excited for the CBD IV. I am excited. So there will be another video coming out pretty soon talking about it. And the doors will be open the second week of July for you to start purchasing. And the 24th, we have the webinar slash info Q&A session. Ty is gonna do like a few slides on CBD because he's so good at it and how it can benefit you at the cellular level. And then we just answer any questions. And then you get to determine what you want to do with the information. You can do nothing with it and stay where you are, or you can say, okay, let me try the CBD because I feel like there's more work that I need to do. And I want to actually cater to my cells and give them what they need to function for you so you can have the best summer. So you can have the best summer. And then when that Niagen party is ready, then you will let you know, and then you can sign up for that. Niagen is also an infusion. Everything's infusion. Our clinic right now, we're turning it into an IV vitamin therapy for healing. IV vitamin therapy for healing, and we only want to deal with serious people. People that are willing to invest. Because I'm telling you, like just give us a month of IVs, you are gonna feel the difference. Everything we recommend, everything we put into your body works. Now, it might take longer for some people because again, we are so inflamed, so toxic, so depleted, so disease. We have so much like nutritional deficiency imbalances. Like if I have this cup is empty, right? The cup is empty, I have water, hot water in here. The cup is empty. We cannot think or expect to just do two, three IVs and have the cup full. So that's why I always ask my patients and you watching this video to listen to yourself. Right? Listen to yourself and go with the flow. To yourself and just take the information you get in, listen to your intuition and make the decision that you need to make. Because at the end of the day, it is a journey, it's not a destination. Whether you invest in buying the food that you eat or seeing your practitioner and pay your copay, you will need to make investment until you die. That's something I said to myself. I'm like, okay, I am my best investment. I'm expecting to invest in myself until I leave this planet. Because this vessel needs constant, you know, treatment, maintenance, constantly. It's not one, two, three, I'm done. No. Now, because I've been on this journey longer than most of you, the investment is less. But at the beginning, oh my God, I was like, okay, oh my God, I was spending a lot of money, a lot of money, a lot of money. That was 10 years ago, a lot of money. And I was like, okay. But it pays off because I got the energy, the stamina, the endurance. I have the life that I always desire, right? I can be there for my patients to guide them. Like I come to work, I wake up at 5 a.m., I come to work and I get on practice better. And I ask questions, I take care of my patients. I'm always available to them. I'm never too tired and too exhausted to be like, oh, never. I'm never because I'm like, okay, this vessel is working for me because I'm taking care of my vessel. But I have to make sure that I am my priority. My body is my priority. My health is my priority. Because many of us are like not healing, we're staying sick because you say you are your priority, but you're not acting like it. When it comes to investing, we run the other way because we want to hold on to the money. You have to invest to make more money. Now, right now, I'm making more money because I've been investing with myself because the investment is paying off. I'm able to go to places and study things and bring things back and help people. But if I was tired and exhausted, I can go to a seminar. I've seen many people that go to seminars, they are tired, they're yawning, they want coffee, not me. I'm like, I'm ready, let's go. What do I need to learn? What do I need to learn? How is this going to affect my patient? How can I bring this back? I'm going to make an impact with this information. How am I going to utilize it? Yeah. I said like, oh my God, I'm so tired. I didn't sleep last night. Nope, not me. And it wasn't that way all of the time. I was the lady with fibromyalgia. Remember? Like I was pain was all over my body. I was sore and discomfort all over my body. I couldn't wait. Like, don't touch me. I was so tired and exhausted. Oh my God. My brain was so foggy. I had to write everything down, right? It's like, what was I supposed to do? I forgot. Not anymore. Like I'm giving my patients the best strategy. I'm literally getting the hardest cases now, cancer people, cancer. So I'm like there for them. When they're in my presence, I'm present for them. And you cannot be present. You can try, you can push yourself. You cannot be present if you're tired and exhausted. And your body's communicating with you louder than ever. And the medication's not working. And you're forcing the medications to work, but medications is like, no, I can't. I've done my job. Like, you need to do something else. All right, so CBD IV is coming. I'm so excited. I hope you're excited as well. We have so many other things in the works for you guys. And I try to bring low cost effective services to our clinic so that I can help you guys because I do know the financial base is huge and I don't want it to be like a lack of money. That's why you are sick. It shouldn't never be because I don't have the money, right? It should be like, okay, this investment is a little hard. I mean, challenging right now, but I'm gonna do what I need to do to even purchase one, two, three, even one, two, three, four. Like, how many can you purchase? How many can I do? Even with organic foods, when you go purchase your organic foods, I don't have money to buy 100% organics, but what can I buy? Organic. The blueberry should be organic. The fruits that you cannot peel off the skin should be organic. And everything else you can manage. So there's always something you can do. And sometimes when we look at the financial piece, we're like, I don't have it. You just whoop, shut the door. You're not open to opportunities and possibilities, or for God, the universe, whoever you believe in, Jesus, Allah, like to guide you because you're just like, whoop. No, I never said I don't have the money. I usually said, okay, well, how can I make this work? What can I do now that's gonna help me find the money? If for sure I don't have the money, if somebody comes to me like, okay, your program is 100K, I don't have $100,000, and we do have coaches out there that are charging 100K. Trust me, I don't have the money, but if I really want to work with that person, I'm like, okay, what can I do now? Because I'm in charge. What can I do now to generate the money so later on I can work with the practitioner? Do they have a payment plan? Like there's always questions. Like when you're open to receive, you're not gonna be like, I don't have it, I'm done. You're gonna be like, okay, what can I do? How can I receive? Right? Like if I were to invest, how can I get return on my investment? So those are the questions you should be asking. All right, so that's it. If you have any other questions about the CBD IV that we bring into our clinic, email us, send us the information. I'm telling you guys, this is another Mig B12, but better. Because CBD, not only, I mean, it's gonna decrease inflammation, it's gonna help you relax internally, where you're gonna feel calmer. The world's gonna be, you're gonna see the world differently than you're seeing it now. It's not gonna be so chaotic, right? If you have any sleep issues, nice sleep. Anxiety issues, headaches. Oh my God, the people with the headaches, you need CBD, right? Like, and it's just gonna calm the inflammation down so that your cells, we have the opportunity to work for you and to function the way you want it to function. That's what CBD does. It's gonna do whatever it needs to get done. All right. So I'll see you in the next video. Please keep an eye on all the communications we're gonna be releasing in regards to this promotion, and I'm so excited, so excited. It took me a while to win this. I've had patients try it for the past few months. Now I'm ready. I'm ready and confident to release it to you all. All right. If you know anyone, please help me. If you know anyone with pain, refer them to CBD. If they're like, oh, I don't know what that is, I'm scared, tell them we don't have an info session again. The Q&A and info session is June 24th, 2025 at 5 p.m. Ty and I are going to talk to you about the CBD, give you all the information you can. And then you need to take part of the promotion because many of you guys let the promotion go and then the price goes up and you're like, oh, I need it. Take 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 part of the promotion, please. Do not sleep on this promotion. 2, 3, 4, take part of the promotion. All right? Okay. Now I'm really gonna get off this Zoom video thing. All right, see you guys next time.